Hello, good evening. In the Drug of the Day series, today we are going to talk about baclofen. We are going to learn its mechanism of action, its class of drug, its structure, and what are the questions which comes from this topic. So let's get started. So baclofen belongs to the class of centrally acting muscle relaxant. Centrally acting means it is acting on brain and spinal cord. It belongs to the subclass of GABA derivative. We will learn about this in further slides. It is used to reduce spasticity. Spasticity is muscle tightening due to prolonged muscle contraction, which is seen in neurological disorder like multiple sclerosis, amyotrophic lateral sclerosis, spinal injury, and flexor spasm. So this is the classification of centrally acting muscle relaxant. The first class is mephenesin congeners. So this is the structure of mephenesin. When there is a chemical modification done on the structure, we get this congeners, which are classiflordone, chlorxanonone, chlorminazanone, and methocarbamol. The next class is benzodiazepine. This is the parent ring, that is benzodiazepine ring, and the drugs in this category are diazepam and others. The next category is GABA derivative. This is the structure of baclofen. The structure is derived from GABA. It is not synthesized from GABA. Category is central alpha 2 agonist. So these are the drugs which will inhibit the release of excitatory amino acids in spinal interneurons, and the drug is izanidine. So before looking at mechanism of action, let's learn about the GABA receptor. There are two types of GABA receptor, that is GABA A receptor and GABA B receptor. So GABA A receptor is pentameric, that is it has 5 subunits, which are 2 alpha, 2 beta and 1 gamma, and its negative effect on neurotransmission is by acting on chlorine ion channels. And here the GABA is binding at beta subunit. Now let's look at GABA B receptor. It is a dimer of 7 transmembrane receptor, that is it contains beta B1 unit and B2 unit. So GABA comes and bind at B1 unit and it will send signals via this coils to B2 subunit. So this B2 subunit will undergo conformational changes and then activate G protein coupled receptor. The GABA B receptor does not act via chlorine channel, it acts via potassium channel. Now let's look at the mechanism of action. The primary action of baclofen is seen in spinal cord. It will depress polysynaptic and monosynaptic reflexes. So as we know, a reflex consists of input by afferent neuron, then integration in the reflex arc, and efferent neuron generates the output. So this is monosynaptic, that is there is one afferent neuron and one efferent neuron. In polysynaptic reflex, there are more than 2 neurons present. So there might be more interneurons present. So this is the difference between monosynaptic reflex and polysynaptic reflex. So baclofen is acting via GABA B receptor, which is G protein coupled receptor. So it will hyperpolarize neurons by increasing potassium conductance and altering calcium flux. So understand the statement, we will look at the action potential of the neurons. So this is resting potential, means the electrical conductance of the neuron at resting place, which is approximately 70, that is minus 70 millivolts. So when there is a stimulus, the neuron will undergo depolarization, that is sodium channels are opening, so there is increased influx of sodium. So now neuron is becoming positive, it will attain peak action potential. So then it will undergo repolarization. So in repolarization, the sodium channels are inactivated and the potassium channels efflux is started. That is, potassium ions are going from neuron cells to outside. Then there comes a stage of hyperpolarization. Here, more potassium ions are going outside neuron cells, so it will cause a negative effect on neurotransmission. That is, the potential of neuron will go more negative than the resting potential, and then finally there is inactivation of potassium channel, and then the neuron again enters resting potential. So this is the action potential of neuron. So when baclofen is binded at GABA B receptor, it will act as selective GABA B agonist, means it will increase the effect of GABA B receptor. So there will be more hyperpolarization and more negative effect is seen on neurotransmission. A point to be noted here is the negative effect on neurotransmission is via potassium conductance interference, not via chlorine channels. Let's look at the side effects of baclofen. Some of the common side effects are drowsiness, mental confusion, weakness, and ataxia. Ataxia means loss of movement control. Serum transaminase may rise. These are the enzyme which causes amylation. These are the enzyme present in the body. If sudden withdrawal is done, that is, the therapy is stopped abruptly after a chronic use, it may cause hallucination. This might be visual hallucinations or auditory. It can also lead to tachycardia, that is increased heart rate, and seizures. Seizure means abnormal neuronal firings in the brain. Let's look at the pharmacokinetics of the drug. Baclofen is well absorbed orally and it is excreted unchanged in urine, means it is not undergoing metabolism. Its T half is 3 to 4 hours. This is the marketed preparation of baclofen, and the dose for baclofen might be 10 mg twice a day or 25 mg thrice a day, depending upon the severity of the disorder. Now let's look at the structure. This is the structure of GABA, that is gamma aminobutyric acid. Why it is named as gamma aminobutyric acid? So we'll start the numbering from here. That is, this is the alpha carbon, the carbon next to the functional group of carboxylic acid. Then it will go beta and gamma. So there is amino substitution at gamma. So it is gamma butyric because 1, 2, 3 and 4 carbons and acid. Now this is the structure of baclofen. One thing to observe here is this part of baclofen is GABA structure, right? So it is a derivative of GABA, means its structure is derived from GABA. It is not synthesized from GABA. One more thing to be noted here is this phenyl ring with para-chloro substitution. It is increasing the lipophilicity of compound. So compound can easily cross the meninges and enter the brain and spinal cord. You can subscribe to our YouTube channel and press the bell icon to get notified when video is uploaded. If you like to join our daily MCQ WhatsApp group, you can leave a message at this contact numbers. You can also contact us via Gmail. This is the question which was asked in GPAT 2015, and the question is, which among the following is structural variant of GABA and is used as muscle relaxant? So let's look at the option. Option A, Tribamet. Option B, baclofen. Option C, metocurine. Option D, cyclobenzaprine. And we know the answer. It's option B, baclofen. As we have studied earlier, baclofen is GABA derivative. That means its structure is derived from GABA and it is not synthesized from GABA, and it is also known as structural variant. That is, We can also call this GABA derivative as structural variant of GABA. Thank you.